G'day and welcome. Welcome to Australia later in the year. I'm Professor John Eastwood, and I'd like to briefly introduce the conference that we're going to be holding later in the year. Oh, what happened to the... Oh, there they are. So the conference theme is to create a truly sustainable and resilient health and care systems that address health inequalities. A transformation is actually needed, a new focus on disadvantaged communities, and an equitable approach to the design and delivery of health and care systems.
The conference will have 5 themes, the first being intersectoral and multi-sectoral approaches to integrating care, developing primary and community-based care, advancing virtual and digital solutions, supporting the health and care of our workforce, and learning from First Peoples, First Nations and Indigenous peoples.
So we have a couple of different ways to present and to submit abstracts. So the abstracts is open and it will close in on the 27th of June, and we encourage non-research individuals and staff wanting to send us your story, your project, so it doesn't really have to be a researcher. So we would like to welcome you, everybody. And this is Sydney. I encourage you to come. Sydney is a very nice city with a lot of things to do. You can replace your bag for some swimmers, and I'm sure you're going to have a wonderful time. There's so many places to see apart from participating in the conference. You got the Opera House, the beaches all over. You will love it. So we'll welcome you there. Thank you.
My name's Nick Goodwin, and I was the co-founder of the International Foundation for Integrated Care, and I'm now working in Australia as director of the Central Coast Research Institute for Integrated Care. That's the joint venture between the University of Newcastle and the Central Coast Local Health District. Our mission is to support research, and particularly research translation, to adopt new models of integrated care to the benefit of the people of the Central Coast and beyond, as well as to stimulate innovations in things like digital health to support older people to live healthy and well in the home environment. So the conference that we have and that we're supporting this year in Sydney in November is a significant opportunity for academics and professionals, health service managers and others to come together to share their innovations, share their research, to create new partnerships and maybe reforge ones that have kind of dropped off during the COVID and come to meet again. So we look forward to welcoming you all to Sydney in November.
Like our colleagues across the country and indeed around the world, we are experiencing a number of challenges. Many of the patients we care for are impacted by the social determinants of health. Often, those who most need integrated care have experienced significant trauma, encountered barriers to accessing care, and need support from multiple services and agencies. For many, their complex needs may affect their ability to engage with our health system, which has become increasingly hyper-specialised. We aim to deliver culturally sensitive and trauma-informed care, and this takes time, careful consideration and adequate funding. This conference is an opportunity to share ideas about innovative and sustainable ways to work. It allows for international collaboration and discussion, which can only lead to better models of care. It helps to foster relationships with low and middle income countries that are experiencing different challenges than the ones we face. It's a truly wonderful opportunity for networking and gives us a chance to travel, connecting with our colleagues from other cultures in a city that celebrates diversity in all of its forms. Above all else, a conference like this will contribute to better systems and therefore better care and better outcomes for our patients and our families in our district and around the world.
This conference is really important because we haven't had a conference on a platform to discuss integrated health and social care after COVID. So we are eager and very keen to listen to the different initiatives, including those initiatives that happened during COVID, and how the systems and our people responded to those very crucial challenges. What were the advantages and the facilitators of integrated health and social care during COVID, and what were the barriers in COVID-19.
So conferences like this are really about enabling policy learning. So it's very rare for policies to emerge from a vacuum. We all need to be able to learn from each other and understand what has been tried elsewhere, what has been integrated elsewhere, and what are the different contexts where health system reform and change actually succeeds and thrives. So this is all about learning across jurisdictions, across states, across countries, and across the whole world.
So here in Australia and on the Central Coast, we herald integrated care as some of the future solution, our opportunity to find models and approaches that can bring together all of our care solutions wrapped around patients, and particularly some of the patients with the most complex chronic health conditions and needs. And so we see a huge opportunity. This conference for me brings together the knowledge that the great minds and the practical solutions that we've found, both on the Central Coast, across Australia and hopefully the world, into a great solution for the future. In designing our future models and services, I held great opportunity and hope for the future.
As the chair of the scientific committee for the third Asia Pacific Conference on Integrated Care, we look forward to receiving your abstracts and to welcoming you to Sydney in November for what promises to be the major Asia Pacific event on integrated care this year. I'm lucky enough to have been involved with the Foundation for over 20 years now, and this is the fourth time that we'll be having a major conference on integrated care in Australia, and perhaps the seventh or eighth time that we've done it in the Asia Pacific region with our colleagues in New Zealand and Singapore. It's a fantastic event. It's a great opportunity to share experiences, to share knowledge, to reform partnerships and associations that we have over the years, as well as to develop new ones. So I really look forward to welcoming you all to Sydney in November.